Welcome to today's video, where we'll be diving deep into a fascinating neurological condition known as Horner's syndrome. This syndrome primarily affects the eyes, but its origins lie within the complex network of our nervous system. We'll explore its causes, symptoms, diagnosis, and treatment options, providing you with a comprehensive understanding of this condition. Horner's syndrome isn't a disease itself, but rather a collection of signs resulting from damage to the sympathetic nervous system. The sympathetic nervous system controls vital functions like heart rate, blood pressure, sweating, and pupil size. Damage to any part of this pathway, from the brain to the face, can lead to Horner's. The causes are diverse. They can include stroke, tumor development in the neck or chest, trauma to the neck or shoulder, cluster headaches, surgical complications, or even infections. In some cases, no specific cause can be identified, which we call idiopathic Horner's syndrome. Even in children, Horner's syndrome can appear as a result of birth trauma or as a symptom of neuroblastoma. To understand Horner's syndrome, let's trace the sympathetic pathway. It starts in the hypothalamus in the brain, then descends through the brainstem and spinal cord to exit the spinal cord in the upper chest. These preganglionic fibers travel up the neck to a cluster of nerve cells called the superior cervical ganglion. From there, postganglionic fibers follow the carotid artery to reach the face, including the muscles that control pupil size, eyelid elevation, and sweating. Damage at any point along this pathway disrupts the nerve signals that normally cause the pupil to dilate, the eyelid to fully open, and the skin on the face to sweat. This disruption leads to the characteristic signs of Horner's syndrome. Horner's syndrome is relatively rare. Precise epidemiological data is limited, as many cases may go undiagnosed or are attributed to other conditions. It can affect individuals of all ages, genders, and ethnicities. The incidence varies depending on the underlying causes. For example, certain types of cancer are more prevalent in specific populations, which indirectly impacts the likelihood of Horner's syndrome developing as a secondary condition. The classic signs and symptoms of Horner's syndrome are fairly distinct. Miosis, or pupil constriction, is a key indicator, resulting in a smaller pupil in the affected eye. Ptosis, or drooping of the upper eyelid, also occurs due to weakness of the muscle that elevates the eyelid. Anhidrosis, or decreased sweating on the affected side of the face, may also be present. Anophthalmos, the apparent recession of the eyeball into the socket, may also be observed, although it's often subtle. These symptoms are usually unilateral, meaning they only affect one side of the face. In children, the affected iris may also appear lighter in color than the unaffected eye, a condition called heterochromia iridis. Diagnosing Horner's syndrome involves a thorough clinical examination and pharmacological testing. The doctor will carefully examine the pupils and eyelids for asymmetry. The diagnosis is often confirmed using eye drops that contain cocaine or epreclonidin. Cocaine eye drops normally dilate both pupils, but in Horner's syndrome, the affected pupil will dilate poorly or not at all. Epreclonidin, on the other hand, will cause the affected pupil to dilate more than the unaffected pupil, a paradoxical response that helps confirm the diagnosis. Once Horner's syndrome is confirmed, imaging studies like MRI or CT scans are typically performed to identify the underlying cause, ruling out tumors, strokes, or other structural abnormalities along the sympathetic pathway. Horner's syndrome is often classified based on the location of the lesion along the sympathetic pathway. First-order neurons extend from the hypothalamus to the spinal cord. Second-order neurons travel from the spinal cord to the superior cervical ganglion, and third-order neurons extend from the superior cervical ganglion to the eye and face. Identifying the order of the affected neuron can help narrow down the potential causes and guide further investigation. For instance, if the anhidrosis involves the entire side of the body, the lesion is likely to be first-order. If anhidrosis is limited to the face, the lesion is likely third-order. The treatment of Horner's syndrome focuses on addressing the underlying cause, not the syndrome itself. If a tumor is responsible, surgery, radiation, or chemotherapy may be necessary. If a stroke caused the damage, medical management to prevent further strokes is essential. In cases where the cause is idiopathic or unknown, treatment is often supportive, focusing on managing the symptoms. Eye drops may be prescribed to temporarily lift the eyelid, but they do not correct the underlying nerve damage. The focus is always on identifying and treating the underlying medical condition that's causing the Horner's syndrome. Because Horner's syndrome is often a consequence of other medical conditions, there isn't a specific way to prevent it. However, reducing the risk of stroke through healthy lifestyle choices, such as maintaining a healthy blood pressure and cholesterol levels, avoiding smoking, and eating a balanced diet, can indirectly lower the risk. Furthermore, prompt medical attention following any trauma to the neck or shoulder can help identify and address any potential nerve damage early on. The prognosis for Horner's syndrome depends largely on the underlying cause and the effectiveness of treatment. In many cases, the symptoms of Horner's syndrome are permanent, even after the underlying cause has been addressed. However, some symptoms may improve over time, particularly if the nerve damage is mild. Recent research is focusing on developing more targeted therapies for nerve regeneration and improving the diagnostic accuracy for identifying the location of the lesion. Further understanding of the sympathetic nervous system may provide for future interventions to directly address the nerve damage in Horner's syndrome. The goal is to improve the quality of life for individuals affected by this condition and ensure they receive the best possible care.